Abdominal clinical examination. An introduction to clinical abdominal percussion. Teaching of general surgery for medical students. Most of the abdominal regions are resonant on abdominal percussion with the exception of the following. Number one, the normal liver dullness, which is present between the fifth intercostal space and the subcostal margin in the mid-clavicular plane. The normal splenic dullness, which is present normally opposite the ninth, 10th, and 11th ribs in the left mid-axillary plane. The spleen doesn't enlarge subcostally except after splenic enlargement to huge size. Number three, the distended urinary bladder at the suprapubic region may reach up to the region below the umbilicus. Number four, the gravid uterus. Number five, other solid abdominal or pelvic or abdominopelvic or abdominal wall swellings. Also, number six, ascites gives dull note on percussion. The clinical values of abdominal percussion. It has confirmation values, identification values, and differentiation values. We start by the confirmation values. Confirmation of previously identified items of abdominal structures by abdominal palpation, like the following. Confirmation of the site of the lower border of the liver. Confirmation of the site of the lower end of the spleen. Confirmation of the boundaries of palpable abdominal swellings. And confirmation of the boundaries of a distended urinary bladder. The identification values of abdominal percussion. Identification of previously non-identified items of abdominal structures by abdominal palpation, like the following. Identification of the site of the upper border of the liver. It is obtained only by clinical percussion. Identification of the site of the upper and lower ends of the spleen. The differentiation values of the abdominal percussion. Differentiation of the pathology of some abdominal conditions. The liver size. The liver may be with normal size if it is present between the fifth intercostal space in the mid clavicular plane to the subcostal region, just felt by finger, by the hand, or not felt. This in the mid clavicular plane also. This is the size of the normal liver. If it is enlarged, it enlarges up more up than the fifth intercostal space in the mid clavicular plane and more down to appear subcostally in the abdomen and enlarge towards the right iliac fossa. This is the enlarged liver. When it is shrunken, it is not felt below the costal margin and its upper border is more down the level of the fifth intercostal space in the mid-clavicular plane. The splenic size. The normal size of the spleen is the presence opposite the ninth to the 11th ribs in the mid-axillary plane. When it is enlarged, it enlarges more up to the ninth rib and more down to the 11th rib in the mid-axillary plane, and with it enlarges more and more duplicated the triple size or more and more, it appears in the left hypochondrium and enlarges more towards the right iliac fossa. The splenic site. Normally, the spleen is present opposite the ninth to the 11th ribs in the mid-axillary plane. This is the normal position of the spleen. Towards the spleen the spleen is either pushed by some pathology from above or by traction by adhesions from below, leading to descent of it to some distance below its normal location. But wandering spleen is a congenital anomaly that the splenic pedicle is too long that the spleen wanders in the abdominal cavity, free mobility in the abdominal cavity. This is the wandering spleen. Also, clinical differentiation between pancreatic or hepatic cancer, especially cancer body pancreas. We can feel in the epigastrium or near the right hypochondrium a hard mass. The hard mass may be a hepatic mass or a pancreatic, cancer body pancreas. The differentiation is clinically by percussion. When the mass is dull, this means that this is hepatic carcinoma because there is no space between the liver and the abdominal wall. When resonance is present anterior to the hard mass, this means that it is behind the transverse colon. That means that it is a cancer of the body of the pancreas. Identification or differentiation occurs by percussion clinically. I have the pleasure to invite you to subscribe to my channel and visit it to view and select what you need. This is the link of my channel. Good luck and best wishes.